My name is Bruce Stevenson. What I'd like to talk about in this video are some of the new dental codes for 2021, but also some of the revised codes and some codes that we've had that are often overlooked. If you go to our website, todaysdentalconsulting.com/CDT 2021, you can download not only this video, but also a PDF version of all the slides. And the links in the slides are active, so you can use those. I'll point some of them out as we go along. The new codes on the slides are in green, and the existing codes are in black. Also, you need to know that the ADA, when they come out with a new set of codes in January of every year, they may create new codes, they may just edit existing codes, and we'll talk about some of those, and they may have you delete some codes. So I'll point those out as we go along also. So just because you've got a new code doesn't mean that you're going to get paid for it, and that unfortunately is kind of an important part of it. So what typically happens is once procedures become more common, then the ADA gets around to creating a new code and often edits those codes. Then finally the carriers will add them to their fee schedules, and then lastly, sometimes way lastly, the carriers will start reimbursing for it. So one of the things you want to watch for, particularly with new codes, are the limitations. And sometimes they've got some limitations that don't seem to make any sense. Like maybe they only do it once every 86 years when Halley's Comet comes around. Maybe not quite that bad, but almost. So just be aware of the limitations. Here's a bunch of new codes here. If you saw the musical Hamilton, you remember the song In the Room Where It Happened. These codes are basically not in the room where it happened. This is where somebody else does an x-ray or a photograph and sends it to the dentist to interpret. So this is capture only. And we've had this already with our cone beams, and now we have it for all these other kind of images. And this includes photographs as well. So this sort of relates to teledentistry here. I don't see a lot of people doing this, but we've got some existing codes in there for real-time teledentistry, meaning you talk to the patient on the phone, one-on-one or Zoom or whatever, and asynchronous, which is kind of in that previous example. If a hygienist, for example, took 4 bite wings on a patient and sent them to the dentist to interpret, the hygienist would bill with one of those 0700 codes, and the dentist would use this code down here, which we've had, to interpret that image. Now, if the patient took a picture of their tooth and sent it to you, then you could look at it asynchronously and you could charge for interpretation. Okay, again, I don't see this happening a lot, but maybe in the future we'll see it more. These are all existing codes that we've had. A couple new codes for COVID testing, one for the antibody and one for the antigen. I don't think insurance companies are going to pay for these for a while. We've had codes already for finger sticks, essentially, for A1C and also for blood sugar. And they don't pay for those either, but it's kind of handy to know about them. So if you should do a finger stick for blood sugar for a patient, at least you now have a code that you can record in your chart. There's a revision to the Prophy codes, both the adult and the child codes. The Prophys now include implants. Before they only talked about teeth, now they include implants. So we kind of have a new mixed dentition definition here, teeth and implants. We now have some revisions to the exam codes, both the comprehensive and the periodic exam, and now they specifically include an oral cancer evaluation. Before they said an oral cancer evaluation when indicated. Now they just say this is included in part of both those exams. Now this doesn't mean that you can't itemize an oral cancer evaluation as a procedure, just to show the patients what you did. I think that's probably not a bad idea. You just can't charge for the procedure. The other thing that's new in these codes, or revised in these codes, is that a comprehensive exam now can be done every 3 years only if the patient has been absent from the practice for 3 years, or if they've had significant changes in their medical or dental health. Okay, people sometimes were redoing a comprehensive exam every 3 years as kind of a routine, and this is saying no, and part of the definition you can't do that anymore. The other thing to kind of point out is don't forget the perio exam, particularly if you're doing root planning and the patient's going to be on a perio maintenance. I think you really ought to evaluate the periodontal exam rather than a comprehensive or a periodic exam. This often gets reimbursed at a little higher level. There are some limitations, but kind of something to think about. I think this is sort of an overlooked code. Some prevention things. If you tell your patients to stop smoking crack, which is probably a good thing to do, we now have a code in there for that specific thing. We didn't have that before. So we also have had these other codes in there. Nobody's ever gotten paid for them by any insurance company, but it doesn't mean you can't charge the patient. Another interesting thing in here is that we have this odontoplasty. This is a new code. Now, we've had odontoplasty or enamelplasty previously, but they've all been part of, we had several codes, but they were all part of the occlusal adjustment category. This is not. Okay, this is different. And the odontoplasty is used a lot by pedodontists and by GPs that do pedo for disking between anterior deciduous teeth rather than putting restorations in there. So here's a new code that's probably better for disking. And this is getting paid by insurance companies, at least for pedo. Another new code that's interesting is the caries prevention medicament. Now, this is basically silver diamine fluoride. And we've had a code already, 1354, for arresting caries. This is for preventing caries. Now, how soon is the insurance company going to pay for that? I don't know. But it's a good thing to know about, I think. The things that you now can get paid for are the 1354, so that's an older code. That's for arresting caries with silver diamine fluoride. I use this a lot for seniors, and most of the pedodontists use it for deciduous teeth. Also in conjunction with the caries risk assessments. People are getting paid for these things now. So you need to take a look at these. The ADA has a form, a caries risk assessment form. You don't have to use that one necessarily. But to evaluate your patients, and this is an assessment, not a diagnosis. So the hygienist should be doing this. There's a link there to a journal of the CDA. The whole journal is talking about caries risk assessment and so forth. Another thing that you get paid for, but people don't do very often, is a preventive restoration, preventive resin restoration. So people are kind of frustrated because the sealants have so restrictive age limitations. And this you can do for any age. You can do it on a permanent tooth. And when the patient has a moderate or high caries risk, this will get paid. And doesn't require any anesthesia, basically a fissurotomy burr or a sandblaster, and kind of open it up and put some resin in there. So good preventative sort of thing to do. So again, all these things are now being paid for by insurance companies, and so you need to look into them if you're not doing them already. Some new stuff in endo. There are some specific codes now for treating external resorption. It used to be combined with apicolectomy but now they're different codes. So you've got separate anterior, premolar, and molar codes for treating resorption. And there's also basically a surgical exposure, lay a flap, take a look, and don't do anything else. Kind of you're going to peek in there and see what's going on. And there are specific codes for that now too. Don't forget to delete the 3427. Some new surgery codes for extraoral implants, for maxillofacial prosthetics, for zygomatic implants. More of relevance for GPs are the frenectomies now, are labial or lingual frenectomy. They used to be the same code, so don't forget to delete that old code out of there. This is also kind of interesting. The nomenclature is new. So we no longer are going to say chairside or laboratory. We're going to say direct versus indirect. So an indirect means it's done outside the office. So for example, a denture reline, where you'd put it in a hot pot, you or the lab puts it in a hot pot to cure it. That's going to be done outside the mouth. So that's an indirect denture reline. It doesn't necessarily mean out of the office. It's out of the mouth, but not necessarily out of the office. So a CIRAC, a CAD-CAM restoration, for example, is going to be an indirect restoration. The other thing that's pretty interesting, I'll talk about in a minute, is this material for direct in the mouth restorations that are long-term provisionals. Some new stuff for implants and perio. Perio Protect now has two procedure codes, one for the maxillary and one for the mandibular. Don't forget to delete the old code. So this is better. This is an example of how they're making things more specific. For semi-precision attachments, and I'm showing the locator because that's probably the most common one, there are now two separate codes. One for the abutment that's going to go into the implant, and the other for the attachment that's going to go into the denture. So there's the abutment, there's the attachment. So this, again, can be done by one provider, or the abutment could be placed by the surgeon, and the attachment could be placed in the denture by the restorative dentist. We also already have a code, but people don't know about it, a 6091, which is replacement of the insert. Now I'm showing a locator here, but this could be an O-ring or any other kind of semi-precision attachment. These are the codes in there to use for that. And don't forget to delete the old 6062 code. This is restorative stuff. There's only one new code, but it kind of got me thinking about some of these possibilities. So the new code is for a prefabricated porcelain ceramic crown on a permanent tooth. Now we've had these for primary teeth before. We had a 2929, which is for this code, which is really a zirconia, preformed zirconia crown for deciduous teeth. This is for a permanent tooth. And this got me thinking about semi-permanent restorations. Gordon Christensen has a good newsletter on this, February of last year. If you click on the link, you can go buy it. If you don't subscribe, it's like 30 bucks. And it's well worth reading. And what it's talking about is using these new products directly in the mouth, just like you would for a temporary, except this material is different. It looks like old Luxa-Temp, but it's not. This is called Luxa Crown, and this is for a semi-permanent restoration. Where might you use this? Somebody who just frankly can't afford a normal indirect restoration. This is going to be direct in the mouth. And they're actually holding up quite well, apparently. So kind of something to think about. Now, these have links in here which are active. So if you click on those guys, it'll take you to those good products. They got lots of videos and other good stuff in there. So these are already existing codes that we've had in here. So we had a 2390, which is a resin crown for an anterior tooth. It's either going to be deciduous or permanent, but both. But it's an anterior tooth, and we'd have a provisional crown in there. This is not a temporary. So when you're doing a regular crown and you want to put a temporary on, this is not the code you're going to use. This is a long-term provisional. And so there are certain indications for that. Be careful about limitations, because if you do this and bill the insurance and get paid, the insurance may not pay for a crown for 5 to 10 years, whatever the replacement period is. But it is kind of interesting, and I highly recommend that article from Gordon Christensen. So hopefully this is useful for you. Again, go to the website, todaysdentalconsulting.com/CDT 2021, and you can download these slides. And again, the links in the slides are active.